Hey, counseling students. So now that we are through mock session 1, I wanted to discuss the second mock session. So as you can see, we are in week 5. You can find the easiest way to find your assignments is by going under the modules tab, and it will bring up everything week by week. So obviously I have not opened up all of the weeks, but you can see they are there. I might just publish the modules themselves, but not the work. You won't see the work. Okay, so let's go to, I'm going to scroll up. The second kind of module list gives you all of the mock session information. So if you are having any issue where you're like, where is it? Again, like I've said from day 1, it is under the mock sessions 1 and 2 information. So I put here the due dates. They're on the syllabus, but just in case you're wondering again, the due dates are here. I've added Zoom directions for viewing. What I noticed in the first one, and it sometimes happens, in the directions, it is explicit that if you decide to do a Zoom meeting, that you need to be shown at all times so that it's not a back and forth of when you're talking, it shows you. When the client is talking, it shows them. Because the nature of it being a Zoom, I do still need to see you at all times. So I included directions here if you needed some extra help knowing how to do that. So those directions are there. We don't need to worry about this. This is over. Here is the final checklist for your mock session. And again, you'll find the documents that you need again: the video consent, the client feedback form, the self-assessment form. You need that for mock session 2, as well as the treatment plan. And I'm going to go over that. And then down here is the e-portfolio setup. I'm noticing that based on your discussion with me, that a lot of you have set up the e-portfolio already. That's amazing, because when you get done each week, you could just add your work into that e-portfolio. For any of you that have not turned in work throughout the week and you've gotten a 0 on it because it wasn't completed, it will still need to be complete for the e-portfolio. So I will be going through to see who hasn't turned in work towards the end of the semester, and I will let you know this is all that's missing, because you will still need to complete that for the e-portfolio if you want to grade for that portion. So that's there if you want to get ahead and start now. So now I'm going to open up the final mock session and checklist. And you'll notice it's very similar to the first mock session as far as still what you need to do. So this is just going to discuss, before the session. This is from the text. And then now we're going into the second mock session, which when you read it, you'll see that it's very much like the first one. The exception is if you are using the same client. Let's say you're using the same client as you did from the first one. Now, because you're going to have a treatment plan, you want to dive a little bit deeper. So now it's more of, I'm not just looking at your natural style. I've seen that in mock session 1. Now we're going to do a little more digging, right? A little more question asking, more responsiveness in nature in that back and forth flow. So again, follow all of these. So far, everyone that turned it in was at least 15 minutes. So great job there. You'll still go through all of these things, what you need to complete. And then you want to go back again, make sure audio, video are clear. Listen. If you haven't already, please go back. I've left a video comment and message for every single student that turned in a mock session. So please go back and listen to that. Maybe re-listen to it, or if you haven't listened to it at all, listen to it, because I've given my take on the sessions. Again, look at these directions, make sure you are adhering to that. The one thing, I did not add. But again, this should go without saying that there should be no alcohol or substance in the room when you are having a session. Right here, if you are, please read this, please be mindful of this. Again, you may conduct a Zoom or similar, and the audio and video must be clear. Make sure I see you at all times in the Zoom. So make sure that there is no shift back and forth. All right, as we are now looking at the treatment plan, I'm not going to read this to you, but just make sure that you are reading, what a treatment plan is and what it entails. And you'll find one in your textbook, and I've already uploaded it to the Canvas page as well, and I will go over that. Below is only a sample treatment plan from the textbook. I personally don't use that one in my practice. I've made up my own treatment plan, but you are more than welcome to use this as a basic counseling student. You do not have to go and be elaborate. Some students they do make their own. But the one thing I really want to get across is a treatment plan is a template. Whatever template that you make on your own, or if you want to use this one, a treatment plan is going to list the essential things, their name, their number, address, things like that. Mine is a little more detailed. This is a little more basic, as it is a basic counseling class, and they are using a community clinic, whereas I'm in a private practice. So one thing to remember that I've stated, I think I've overstated, and everyone has adhered to, I just want to make it very clear again that there is no diagnosis. So for you as a student, you can just leave this blank or you can exit out. As you are still a student, you do not have the credentials or the license to diagnose anybody. So we don't want to say, I'm sending you to get prescriptions or drugs, or I'm diagnosing you with anxiety or depression or bipolar or schizophrenia. We are not doing that because you're not at that stage right now. So if you want to use this template, just simply, leave it blank or exit out. So summary of the patient's original concerns. You can put some notes in here. Again, I don't use this, but for the sake of this, class, you can. Identified patient strengths and resources to be added to throughout therapy. So these are things that you would continue adding. So again, this is in the book, not what I would use because it does say interview progress narrative. We call those in our world, you can use whatever you like. We have DAP notes. We have SOAP notes. Those are just the acronyms for it. So within this treatment plan, the main thing I want to kind of hit home, especially when you're post-grad and you're doing practicum and internship, is that when a client comes in, they come in with some problems. Usually there's multiple problems, at least 2 or 3, right? And they might have a catalyst. It might be something brought them in therapy, right? It was the camel, the thing that broke the camel's back, right? And so they are coming in for this issue, but there's other issues. So we want to address, okay, what is the first problem that brought them in therapy? You want to just be very mindful. It's not a big thing, but what is the problem that brought them in? We want to be clear, concise, and one line is good. So what is the problem or the first concern? Followed by what is the second problem or second concern, and then the third. With each problem, there's a goal, right? We have to have a goal for that problem. And when you have a goal, it's, think about what is a goal? This goal that we have to get through this problem. How do we get through that? We get through that through interventions or strategies. We have to be intentional about interventions. We don't want to use blanket statements like talk, get help. So interventions are rooted in theory, right? So cognitive behavioral theory practices, solution focused practices. What are the interventions that you are going to use in resolving, their problem? Because I'm going to tell you, these need to be in place, because once you do become a therapist, if your notes are ever, subpoenaed by a judge, or someone wants to see their notes, if you are a person that takes insurance, you will have to have this documented, and it will have to be clear and concise. It can't just be talk to husband, talk to wife. That's not an intervention. Interventions are rooted in theory. And then finally, progress toward goal. What does that mean? That's kind of like, what is that outcome? How am I going to see progress? So I've got this problem, right? And with this problem, we want to come up with some goals. And when we have those goals, we have to have interventions to, for those goals. And then how am I going to know in all of my weeks or months or whatever it is working with this client, what does progress look like? What am I going to see at the end? That's what you want to put in here. What does progress look like? And then, of course, the signature, they sign. Again, in today's world, we call them clients. Some people, old school, call them patients. You can use this, or my suggestion is go on the internet in a positive manner, in a good manner, and look up, you know, depending on the keywords you use, look up treatment plans for mental health professionals. There are so many templates that are really good, and then you can download those, you can tweak them, make them your own. But the key thing is we have to have the problem, the goal, the interventions, and then basically the outcomes or the progress. Those need to be included in a treatment plan. And obviously, diagnosis would be there, but for the sake of this class, we're not doing any diagnoses. I did notice a lot of really great standout moments in the mock sessions that I viewed, and I was very impressed with a lot of the back and forth dialogue. Again, some things to really hit home that I'm really big on are we don't just ask blanket statements, how does that make you feel? We do not do that. We want to be specific. How did that betrayal lead to this? Or I'm just throwing stuff out. When we're asking about feelings, we want to know what was the thing that made the person feel that way. So we want to attend to that. This way it's appropriate, and it's not just this overarching question. Again, we are not advice givers. Please remember that advice is for transactions and things like that. When clients come in, they may think advice, right? That's not really it. In the mental health professional, again, we are here to support our clients, to guide them, to provide them resources, to give them insight so that they can have their aha moment and work through what brought them in therapy. So we just want to make sure that what we're saying is correct. Because I've stated this before, I get clients that come in from other therapists that say, this is what my last therapist did, and this is why I left. Either it was they didn't really listen to me, they asked me questions that didn't pertain to the reason I'm here, they didn't look at me, or they were writing notes the entire time, right? So we want to make sure that we are asking the right questions. Now, I've said this to some of you in your video comments that I've left, that we want to make sure that some of the key things we're asking, right, when we're conversing and when we're teaching our clients, those go-to words are I, me, we, what, and how. Those are conversational words. those get to the root of things. What we want to refrain from and teach our clients to refrain from when they are talking and trying to work on communication issues, we want to stay away from the words you, why. Those are the two big ones. You, why, always, never, can't, don't, should, but, and fine. I think there's another one that I'm leaving out. And the reason for that is those words easily come out so quick. Like, why did you do this? You always do that. I can't do this. I can't do that. We need to stop because our brain does not process those words, which are the I, me, we, what, and how. Those we have to actually stop and think, what am I saying? And again, we don't want to say, I'm upset because you don't listen, right? The person you're communicating with, what they're going to hear is you. They're going to hear, oh, I don't do that. So when we're teaching our clients and giving them information, it's so difficult to not say that. And that's the reason we have to stop, pause, think about what we're going to say. And so those are some words that maybe take into consideration. So not why are you here? Like in counseling, why are you here? Why did you come to counseling? Kind of defensive. Sometimes they don't know why. So you could say, hey, let's explore. Let's explore some of the things that brought you into counseling. Let's explore what some of the issues are. That gets them to think and open versus why are you here? So that's really important, the language that we give to our clients. So work on those things. And if you need any guidance on anything, please feel free to reach out to me. I'm sure I'm missing something, but this is the main thing. Again, if you're using the same client, we want to dive a little deeper. If you're going to use someone else, that's totally acceptable. Just make sure that we are exploring these issues, and we don't want to end the session with see you next time. We want to make sure that in that session, you are giving them homework, meaning you're giving them strategies. And I've had some, that did strategies in mock session 1. For example, one student said, hey, I want to do a breathing technique with you. I'm going to tell you about this breathing technique and then let's do it together. So now the therapist is demonstrating what they want them to do if they get through a panic situation. So whatever it is, whether it's, hey, I want you to think this week about whatever and write some things down. Homework doesn't mean worksheets. Sometimes it can, but that's not often. I have so much different types of homework that I make on the cuff in the middle of a conversation, and it works really well. So make sure that I'm seeing a strategy, make sure I'm seeing something more in depth, and that the session doesn't just end abruptly. It needs to end with, like, I'm proud that you've come in. I'm really excited that we're going to be working on these things. Do it how you want to do it. Just make sure I'm seeing more depth. I'm seeing a treatment plan with whatever the problems are. And again, not just one problem. There needs to be at least, there's more problems, right? People essentially come in with more than one. So just use your own professional kind of thing, and I'm really enjoying seeing these mock sessions because most of them are true and they're real, and that's what makes it that much greater to watch. So now again, we're going to dig a little deeper. If you have any questions, please, comments, concerns, please feel free to reach out. And well done, well done. So I am here to support you. The big thing is communication. If I don't know, I don't know. So I need communication. I need emails. I need things just like you would want that in therapy as an instructor. I need feedback. If something is going on, that's something that there needs to be a conversation. So hopefully you finish out strong and enjoy the rest of your week. It's been heavy out there, a lot going on in these last especially last, week. So just let me know. And I hope you have a great and restful week. All right. Talk to you soon. Peace.